KEYNOTE-426 was a randomized phase 3 trial of Axitinib plus Pembrolizumab versus Sunitinib in first-line metastatic kidney cancer. And those data were initially presented, the primary analysis over a year ago, published in the New England Journal, which showed an overall survival benefit to the combination over Sunitinib. And the study actually met its endpoints at that time. But there's a lot of interest among clinicians, appropriately so, to look at long-term outcomes. What do we see long-term? How do people do? Do any people have durable responses? And importantly, do any patients have treatment-free responses or survival where their cancer is controlled and they're able to wean off of the different therapies? So the update we presented at ASCO this year got to some of those questions. First, we show that Axitinib plus Pembrolizumab remains superior in terms of all of the endpoints discussed previously: overall survival, progression-free survival, across the follow-up that we did now, which now includes up to 2 years. It'll be really interesting to look to further updates, and we plan those, to look to how people do beyond 2 years, because in the study, Pembrolizumab ceased at 2 years, and patients could continue on Axitinib or stop both drugs. And so that information and those data will really speak to treatment-free survival. One of the other things we looked at as an exploratory analysis in the 426 data was the correlation between depth of response and survival. It may stand to reason that the deeper response, the more shrinkage you see, the longer folks will live. That relationship actually did hold true with Axi-Pembro, but was not seen with Sunitinib. And so this sort of helps how we think about, in my mind, CRs, what a CR is a deep PR just as good? Certainly on Axi-Pembro, we think so. So we look forward to presenting further updates of these data as patients continue to survive and do well, having participated in the trial.